defining seemingly contradictory concepts, we're exploring their roles and we're not placing a judgment value. They all have their place, and much like the Chinese concept of yin and yang, which is the graphic you can see there, they are essential to one another and inextricably linked. A second quick note, a lot of the concepts included in this discussion of mind-body medicine weren't a full webinar on their own. So this will be more of a survey of what mind-body medicine is rather than a deep dive. So first off on the definitions, allopathic is a word that isn't used a lot and is not in most people's lexicon, but I felt it was important to give a definition in direct relationship to holistic and provide more context for what we mean when we say holistic. So the allopathic approach is what is most commonly thought of when we think of modern Western medicine. It's the use of drugs, radiation, and surgery primarily, and these are all interventions that act upon the body to interrupt the process of a disease to either alleviate symptoms or remove or cure the pathologic element entirely. And then the holistic approach looks at the state of your well-being, mentally and physically. It will consider things like your daily environment, your stress level, your diet, your sleep habits, and attempt to address symptoms or disease by investigating their impact on the whole system. Another clarification that's worthy of addressing is the naming of a lot of mind-body medicines and practices. The word alternative is falling out of favor for good reason. Mind-body medicine is meant to complement, not replace anything. So if you ever have a practitioner claim that you should quit chemo and they can cure your cancer, run and do not let them treat you. However, some of these therapies should be tried as a first course of action before stepping up interventions, especially ones with maybe more side effects or more risk. For example, if a yoga practice manages your back pain and you can avoid surgery, that's great. And again, this should always be done in concert with informed and active collaborative care with your primary care provider. Therapy and practice are two terms that are much less loaded but need to be defined as well. What we're talking about when we say therapy is an external experience with the active role of a professional who's providing a service. Whereas a practice is something more self-directed, where the work exists primarily internally. But that's not exclusively true. For example, a yoga teacher helps facilitate your personal yoga practice. So there are professional providers in that context as well. This is a short list of some of the most mainstream modalities we think of with mind-body medicine and a holistic approach to our health and well-being. Acupuncture and TCM, which is traditional Chinese medicine, that's the acronym for that, massage therapy and music therapy. All of these are provided at the Cancer Center to our patients, and if you're getting care at another hospital or another clinic, check in with your provider there and see what's available. A lot more clinics are starting to incorporate mind-body medicine in their integrative therapy approach. And again, here's a list of some of the personal practices that, therapy, yeah. So the mind-body practices include yoga, tai chi, and qigong, meditation, guided imagery, and breathing practices, and massage for self-care, which I think Karen will touch on quite a bit in her second half of this webinar. But this is, again, an incomplete list. There's a lot of different modalities and practices that fall under the umbrella of mind-body medicine. Because I'm an acupuncturist, I can't let an opportunity go by to dispel some of the myths around the concept of qi. That's a word that is notoriously misused and misunderstood. The most common and literal translation of the Chinese character for qi is simply breath. It can also be translated as air, vital life force, or energy, which, like qi, has a number of different meanings as well. For the more physiologically minded people, words like bioelectricity or biomagnetism can apply, and that helps wrap their brains around, people who have that type of thinking, helps their wrap around the concept that it's essentially the natural electricity present in a living thing. And then finally, what it's not magic, it's not a power, and it's not a Jedi mind trick. So, why does this matter, and why are we trying to educate people about mind-body medicine? The holistic approach says you're a whole person, bigger than the sum of the parts, and definitely not just a disease. Getting body work or cultivating a personal mind-body practice can act as therapy for the relationship that you have with your body, especially as you ask it to carry you through cancer diagnosis and treatment and recovery. A good amount of mind-body medicine involves touch. The power of therapeutic touch is well documented and a big component of connecting the mind to the body. I think we're even more acutely aware of this in the touch-deprived times of COVID. Many studies have been done around stress responses like heart rate, blood pressure, anxiety, some of the stress hormones, and how they respond to positive touch. A lot of people, for example, don't realize how tight their shoulders are or that their back is tight in a certain spot until a body worker touches them and creates the space and experience for that communication to happen between the mind and body. And like I said, you're asking a lot of your body going through this journey, and it's important to talk to it. A lot of things happen to us as we age, as we experience life, and as we get cancer treatments. And those change and affect us and the way we inhabit our bodies and how we feel towards our bodies. We can feel proud of our bodies or betrayed by them. Across the many cancer interventions, a number of changes can take place. For example, if we lived a really active life, whether a marathon runner or taken pride in always being the person asked to open the pickle jar, loss of strength and stamina can be really disorienting. Changes in our physical appearance, losing hair from chemo or skin changes from radiation therapy, can make us self-conscious and feel nervous about how our bodies are presented in public or even in private in the mirror. Chemo-induced peripheral neuropathy, or CIPN, which was discussed at last week's webinar by my colleagues, is when you have loss of sensation, numbness, or tingling in the extremities, either the fingers or the feet. And that can make walking difficult or even just buttoning your shirt tricky. Chemo brain and mental fatigue can make us feel frustrated or crazy or angry. And pain, finally, is often involved in the cancer journey, and pain is exhausting, both mentally, physically, and emotionally. It takes a toll, and it impacts our sense of ourselves. All of these cancer-specific changes have psychological, emotional, and mental elements as well as physical. And if we approach the situation with that in mind, the resulting state is not just physical health, but overall well-being. Consistency is important and often the hardest part of a lot of elements in caring for ourselves, but regularly checking in and caring for your body in a kind and compassionate way can have such a positive impact on your overall well-being and your ability to handle the physical and emotional stress of treatment. And then finally, to close out my portion of our talk, before I turn things over to Karen, I wanted to pick a small selection of resources in case anyone is interested in further information. The list of books on mind-body medicine includes hundreds of titles, as you can imagine, but these few are a good place to start. Everything except the memoir, the second one there, are a couple of decades old now, so they have reliably withstood the test of time. The first book, The Body Keeps the Score, is it investigates how the body holds on to our experiences, specifically trauma, but also in general, how our bodies and our minds both remember, quote unquote remember. Flat, a memoir written by a queer woman who has a pretty harrowing and very medicalized breast cancer journey that makes her question her body and examine what femininity can look like. And then the third one on the list, Molecules of Emotion. This is one of the landmark works on mind-body connection that really explores how our emotions affect our physical selves and then provides a lot of the science to back it up. And then for anyone who's specifically interested in traditional Chinese medicine, this book is a pretty accessible and comprehensive guide to TCM theory. So I hope you have found some value in this information and hopefully have a better understanding of what mind-body medicine is and what it can be. And with that, I will turn things over to Karen.
Okay, here we are. Thanks so much, Lena. And I think some of what you said dovetails well into what I'm going to talk about now, which is the second part. And this is kind of a practical part about relieving pain via muscle spasm release. I am, as Devin said, I'm a muscular therapist in the Integrative Therapies program at MGH, the Cancer Center. And I am also a nurse massage therapist in private practice in Belmont. I'm so excited to be here with you tonight because I'm going to show you something that I really consider about the coolest thing I ever learned in my whole life. And the reason it's the coolest thing I ever learned in my whole life is that over my career in the last 16 years, it's really been responsible for easing more pain and creating more comfort, as well as sometimes allaying anxiety than anything else I've ever learned. So anyway, again, it's about relieving pain by releasing muscle spasms using a pinky ball. And I think you got a message from Devin maybe today about running around your house and trying to find a tennis ball or a pinky ball or something like that for this demonstration, so you could try it out yourself. No worries if you don't have one. We can do it later, and it's no problem. Another thing that I wanted to say before I start is that a lot of what I do as a massage therapist is when people come to me in pain, which is what people most commonly come to me for, at least in my private practice, and to a good degree inpatient and outpatient at MGH, is what is this pain? And so what my responsibility is to try to eliminate the muscular sources of pain and rule those out, so that we can say either it was the muscles, or else it's something else that needs more looking into, probably by your medical team. So that's another reason why this technique that I'm going to show you is so useful. And a lot of times what it does is it allows people to say, oh, that was a horrible pain, but now it's gone, so my mind is much more at ease. Talk about a mind-body connection. And I know it was just, even though it felt really awful, it was just a muscle. And it's really great to be able to say to people, it's just a muscle, don't worry about it. All right, so why, next slide we're going to look at is pain is bad. It's really bad. It makes you miserable, puts you in a bad mood. It hurts, you know, but it also has a really, really negative impact on our bodies, as Lena alluded to. Let's look at that a little bit more closely. Here are some of the effects of pain. The effects on the mind. Again, this is a thing that's happening in the body, and perhaps there's nothing greater than pain that has this dramatic effect, starting in your body, dramatic effect on your mind. The effects on the mind include, but aren't limited to, anxiety, fear, and depression. Hormonal effects are increased stress hormones. That's the hormone that Lena was referring to, the cortisol. And increased cortisol causes increased blood glucose, which, if you're a diabetic, is not a good thing. And really importantly, one of the hormonal effects is immunosuppression. And as you probably know, as cancer patients, many treatments that we get, as well as the disease itself, can cause immunosuppression in and of itself. So who needs more? It's not something we want. So effects on the heart include increased heart rate and blood pressure. Again, you know, don't need it. Don't need it. It's hard on our organs, and decreased oxygen to the heart can sometimes cause cardiac problems. The lungs, again, this is a really important one. When you're in pain, the last thing you want to do is cough, probably, because 9 times out of 10 it makes the pain worse. The other thing we often do in response to pain is breathe shallowly. Those two things increase the risk of lung infection and collapse, because when you don't take a deep breath, you can't get those little air sacs at the bottom of your lungs to pop open. Effects on digestion. It slows down movement in the gut and can increase or cause nausea, vomiting, and constipation. Again, these are some of the problems that you already have with treatment and sometimes with disease. You don't need more. And finally, muscles. This is really important also, because there's so much data now, so much research about why everyone in the world needs physical activity, but particularly people who have cancer have longer life expectancies and better quality of life if they keep moving and exercise. So decreased mobility and movement because of pain is a big deal. It's a big deal. Increased tension in other muscles causing increased pain. Sometimes we can get into a really significant bad cycle, a cycle that feeds on itself. And then also when we don't move a lot, we're at increased risk of blood clots and other kinds of thromboembolic events, blood clotting events. And again, some cancers already cause an increased risk of that, and you don't need one more thing. So gotta move. All right. So the next part, I'm just going to go through how this goes, how we do this. I'll say that it's not too hard to do this muscle spasm release with a pinky ball or another ball. But in my practice at the hospital and in Belmont, I obviously do this with my fingers, my thumb, my elbow sometimes. The point is to get the pressure right, and I'll talk about that in a minute. So you can do this a lot of different ways, and if you have a friend who's willing to put their thumb maybe into your shoulder muscle, that might actually work pretty well. So anyway, okay, so I'm going to talk about choosing the right ball, which muscles we're going to treat, any cautions or why you need to be careful, and what the actual process of this is. Okay. So our choices are, this is a pinky ball. You can see it's pink, and it even says pinky. You can get these at your favorite internet retailer. I won't mention any names. We used to play with these. You can see it's kind of squishy. Used to play with these things, play jacks if you're an old person like me. But it was a much smaller ball. But that's the kind of squishiness that it is. It's sort of, it's not usually as hard as a tennis ball. But it's not like a stress ball, okay? You can use a tennis ball. This tennis ball happens to be old and squishier than normal. This one would work fine. When they're really hard, sometimes they're a little too hard, and I'll get to the point of what kind of pressure are you looking for. Here's a lacrosse ball that my son-in-law does his compressions with, and this is hard as a rock. And for 90% of the population, you don't want this one. But you might if you're young and vital. This is a massage ball for feet. This is hard as a rock and has points. You don't want this one, okay? So stick with the pinky ball or the tennis ball, and if you're feeling like you're not getting enough pressure, the lacrosse ball. All right, these four muscle groups are the most common ones that I find get into trouble and cause people lots of pain. Trapezius, rhomboids, gluteus, medius, and piriformis, and I'll show you pictures of all those in just a second. The trapezius muscle is enormous. It goes all the way from your head out towards your shoulders and then down into your back like that. It's responsible for keeping a lot of things in your back stable, as you can imagine, and doing some movement with your head. It does a lot for shrugging your shoulders, and when you're in traffic and you're gripping your steering wheel, your trapezius is likely to be very activated. We can bear a lot of pain in our trapezius, or not pain, but tension, I should say muscle tension in our trapezius without even knowing it, until someone puts their thumb in it, and then you're like, ow. Muscles really shouldn't hurt. So if that hurts, that's not what we want. Next one is the rhomboids, and you can see the rhomboids sit underneath the trapezius, but it's really famous. These two are really famous for spasming, and I can find knots in the rhomboids in lots of people. And in almost everybody who has pain in that area, it's the rhomboids. The rhomboids are responsible for pulling your shoulder blades together, your scapula together. And so again, you know, anything that we have movement that goes back like this, that's the rhomboids. The gluteus medius. This is a big standing muscle. We use this muscle for stability for our pelvis and when we're standing and also walking. And I'm finding that a lot of times when people say, oh, I walked much further than I usually do, and all of a sudden I've got this horrible pain in my low back, it's frequently the gluteus medius. Interestingly, with the other two upper ones, upper muscles, to my hands, it feels like a really, really tight band. The gluteus medius produces these almost eggs. They're really, really tight. It feels like a really hard egg in the back of your hip. Oops. And finally, the piriformis. The piriformis runs right across the butt, the middle of the butt, basically, but deep. It's a deep muscle. It's not on the gluteus maximus, which is the one on the outside, the huge muscle. It causes problems a lot. And what I see most often is I see tension there for a lot of different reasons. But what I wanted to point out was it's unique in the sense that it can cause sciatic pain. And the reason for that is, as you can see on the left-hand side, the sciatic nerve can sit between the piriformis muscle and the bone there, or it can also run right through the middle of the piriformis muscle. So when that muscle gets tight, it can squeeze on the sciatic nerve and send pain down your legs. So when I talk about one of the things, if somebody comes to me with sciatic pain, I can just say, let's release this muscle and see if your pain goes away. And then we'll know that it's a muscular thing. And if that doesn't work after a couple of times, then, it's time to go further. Or sometimes people come to me saying, oh, my doctor said it was piriformis syndrome or something like that. Okay. So that's a big money one that I wanted to show you. Okay, here's a review in a different view. The trapezius at the top. The rhomboids are sort of right there. The gluteus medius are a little bit more around the corner there towards the front, but basically that's where they are. And the piriformis are right through the middle. All right. Okay. Some cautions before we do this. We're going to be putting a pinky ball or a ball against one of our muscles and then pushing down on it, okay? So a couple of cautions about this. First, you wanna know, you don't wanna do this in a location on your body where you have disease. That might be obvious, but don't do that. You don't wanna be over your spine. You want to know if you have some fragility in your bones. You don't want to be doing it over fragile bones. If you have bleeding problems, like your platelets are low from chemo, or you're on an anticoagulant, you're on a blood thinning medication, and you're not sure if it's okay, you want to be really careful. Putting too much pressure when you have those kinds of situations is going to cause bruising. So again, pay attention to the pressure when you're doing this. Okay, here we go with the process. I think what I'm going to do is just run talk through it, and then I will stop screen sharing, and you'll get a bigger picture of me, and then I'll show it to you when I do it I'm going to be backing up and doing it against a wall. So first, what you want to do is you want to find the spasm. You're going to put the ball somewhere, and you're going to put a little bit of pressure on it, whether you're usually against the wall would be the easiest way to do that. Sort of drop the ball and find a place that's painful. Muscles really aren't supposed to be painful unless they're too tight. So that's how you're going to find a spasm. Or again, if you're doing the lower back, again, like right around here is the glute medius. You can put that against the wall with the ball and see if that's painful when you lean against it. Then what you're going to do is you're going to put direct pressure. We call it ischemic pressure because it has to be sort of deep. It's thought that the reason this works is because the pressure causes some disruption in the neurotransmitting of signals, and everything gets confused and the muscle releases. We don't really know why it happens, but you do want some pretty significant pressure to a pain or discomfort of 5 or 6. So if you are leaning against the wall and your pain is 7, back off a little. In other words, like stand up a little bit higher with your feet closer to the door. And I'll show you that again. And if it's not high enough, it's like a 2 or 3, then walk your feet out away from the door and put a little more pressure. You can also change the ball because, as we talked about, the pinky's probably the softest. You can go to a lacrosse ball or to a tennis ball that's in better shape than this one. You can also lie down on the floor. And if you're still trying to figure out how to get the right pressure, you could have a ball. Maybe you don't want quite so much, put a towel over it. Lots of different ways to try to figure out, get onto the bed if it's too much pressure. Lots of different ways to kind of try to figure out how to get to that 5 or 6, but that's a really important piece of this whole equation. Next, so let's say you've got your pressure to 5 or 6, you're gonna lean into that ball to 5 or 6, and then you're gonna pretend like you're breathing, like exhaling into the ball. You don't have to change your breathing, just pretend like you're exhaling into it. It's really interesting to me, talking about a mind-body connection, that when people do this, all of a sudden everything relaxes more. So that part's probably not essential, but it really does help. And so it's really a convincing example of the mind-body connection. Okay, so you're going to be exhaling into the ball. You're going to wait 2 minutes. 2 minutes is going to seem like a long time, but you're going to wait 2 or 3 minutes, okay? And in that time, you're going to pay attention to what the muscle is doing. What should happen is it should go from pain of 5 or 6 down to just feeling like pressure. And if it does that, that's the muscle releasing. Sometimes I'll tell you, sometimes what happens is when you get on the ball, you'll feel pain radiating down your leg or up into your head is a really common one if you're on your trapezius muscle. Don't worry about that. Unless you get 2 minutes in and it doesn't go away. You might want to wait 1 more minute, but we don't want that to last forever. But generally speaking, it subsides. So you can just watch it. But a lot of times people do say, oh, there's this sensation going up into my head when I'm on their trapezius muscle. And I just say, just breathe and it's okay. So you're going to pay attention to what the muscle is doing. And hopefully it will release and the pain will just feel like pressure. It won't be pain anymore. It'll just feel like there's a ball underneath your back or wherever you are. Ideally stretch the muscle after that. So kind of look up, which muscle you might have been on and I can't go through that right now. But anyway, that's ideally what you would do next. All right, I'm gonna get bigger here, I hope. Okay, I'm there, right? Okay, so again, find the spasm. I'm gonna go back here to my feet are like a foot out from the door. I'm gonna find a spasm. That hurts. Okay, I'm gonna just lean against it. And that's about a 5. So I'm just gonna kind of breathe into the ball as I exhale. And I'm going to wait 2 minutes, but I'm not going to do that tonight, but that's what you're supposed to do. And actually, I can already feel this releasing. It's really just feels like pressure. And there are times when sometimes I'll be on a muscle, and after about 5 seconds, the person will say, oh my gosh, that's so much better. So it can happen fast. If it doesn't release, okay, so sorry, go back. So you breathe into the ball, pay attention, and then pay attention to its releasing. If after a couple, and then stretch ideally. So if after a couple of minutes it does not release, You may want to try it again later in the day or the next day. But it just may not be quite ready to release. I had a patient 3 weeks ago who was an inpatient, had tremendous pain in her hip, and I did this with my thumb, and it was a little better, but it wasn't completely better. And she came back last week for another round of chemo inpatient. I saw her then, and we were able to do the same thing and release it all the way. And she looked at me and she said, "That is like a miracle." And it's the same word that actually another patient who had a big spasm up there and was in some pain. She was an outpatient about a week ago. Same word she used. It's really amazing. It's really quite interesting. So anyway, that's basically the whole story, the whole way you do this. And if there are questions, I guess that's where we are about now. I guess I'll turn it back over to you, Devin.
Thank you, Karen and Lena, for your wonderful presentations and your demo. I am just going to very quickly make a note for everyone. Sorry, for our upcoming sessions. Next week, we'll be looking at the role of acupuncture in managing treatment symptoms, specifically fatigue and hot flashes, but the presenters will be talking about other side effects as well. And then in our last session, we're looking at yoga to manage symptoms and stress. And again, up top here on the slide is the page to register, as well as where you can find recorded sessions from our previous weeks. And if you'd like to follow the Cancer Center on social media, here are the pages for Facebook, Twitter, and Instagram. And now we do have some questions that have come in. And if you have a question and you haven't submitted, feel free to type it into the chat box and we will get to it. I'm interested in trying acupuncture and massage, but those services are not currently being offered at my cancer center due to COVID. Do you have any suggestions on how to find a practitioner who works with cancer patients?
I can answer that, I think, to start. It is definitely tricky right now with COVID precautions in place. A lot of practices are not back up and running. I think the most important thing is to make sure whatever provider you see, whether they're at your cancer center or out in the community, is that they're credentialed properly, that they're licensed by all the proper boards, both in the state and nationally. That should be readily available on anyone's website. There is not a ton of specialty training. There's not a whole lot of oncology acupuncturists or oncology massage therapists out there that specifically work with that. Karen, maybe you can speak to the massage therapy part. But the main thing is to make sure that you are out, like if you're getting a radiation treatment, make sure you're out of radiation for a good amount of time. The skin is all healed and intact. And then again, with chemo, things like platelet counts matter. So you're gonna wanna make sure that you know your blood work and that you know you're not neutropenic and you're not anemic and you don't have low platelets, because you're not gonna wanna get acupuncture under those circumstances. So that's the best I can answer that without, looking at a specific provider and what their credentials are and what their treatment plans would be. So Karen, I don't know if you want to mention anything specific.
What I would do if I were looking is to go to the American Massage Therapy Association website, and it has a different, look under American Massage Therapy Association, and under that, when you Google that, it will say find a massage therapist. When you click on that, We do have actually a specialty of oncology, and you can find the people who specialize in oncology massage, which for us is really important for a lot of different reasons. So that's what I would do. And I would also call the person, have a conversation with them before you go in. If you don't see, if they have a website and you don't see a lot of information on COVID, this actually was the Spa Association came out with huge long lists of things that you have to do if you open your doors as a massage therapist. There's lots and lots of sanitizing that goes on, and a lot of different things. So you want to make sure that your therapist is doing that. And so that's a question that you want to ask if you find somebody that you think would be a fit for you.
Thank you. Are massage or acupuncture being offered now at MGH, either Boston or the Waltham campus?
Yes, we are in the Boston location, and I believe Waltham a few days a week. Maybe not, the availability might not be 100%, but those two locations do have massage and acupuncture in place. So I think all you have to do is talk to your provider about getting an order put in, and they should be able to connect you.
Those are, I should say, those are sort of brief sessions while you're getting your treatment, all of that, as well as at the main campus, inpatient. We do inpatient. We were, prior to COVID, we were doing full body table massage and table acupuncture, which is a 45-minute to an hour session. Those have not come back yet. So that's not an option yet. But if you're getting treatment at MGH, we do have massage therapists and acupuncturists who come around and do treatments with people.
And are the sessions during, are they the sessions during treatment? Like, is there any difference between being in an infusion or an inpatient as well?
I think Irene might have just written to you, the director of our program. I could only read just a few words, so Devin, you might be able to read the rest of it. I didn't see the rest of it.
In Waltham, acupuncture and massage therapy are in the infusion units. And similarly to what you just said, Karen, the full body clinics are not open yet because of COVID. So thank you, Irene.
And then to answer, I think, your question about the treatments happening, how they happen, in the infusion unit, for example, people are in the chairs or their rooms for any number of hours. And so while you're hanging out in there, that's when a massage therapist or an acupuncturist would come in between, your nurse and a nutrition consult, or in between a doctor visit. And that's when that treatment would happen.
Thank you. A couple other questions coming in. There's a question about the spasm test, Karen. Can I sit down to do the spasm test?
You can. Yeah, again, what's really important is it's the right pressure. You absolutely can. You could probably hit some good muscles that way. I'm not sure you can reach the piriformis, and you certainly probably can't reach the upper one, but you can try it. Anything that's uncomfortable. I do want to answer the other question too, that how do I know if it's something I need to talk about with my doctor if the pain doesn't release? That's a really important question. Thank you. Yes, I would say if it doesn't release, if it doesn't feel any better after doing it once one day, once the next day, and you've tried other things, it's worth a call to the doctor and see if sometimes what they say is just try some Tylenol or ibuprofen or whatever. But anyway, that's not part of my thing. But anyway, yeah, any pain that persists and you do this technique and it doesn't have any impact on it, it may not be it may need further investigation. And the other thing that can happen is it can release and then it can come back. that's a signal that you may need some physical therapy. Sometimes if it's been spasmed a long time, it will take a couple of times with this, but if it keeps coming back, it's a signal that there's some imbalance in your body that needs to be investigated. So so that's what I would say. And I would say, you know, if you know of a massage therapist who does this technique, it's a little easier. It's a little easier and a little more effective, people tell me, when a massage therapist does it than when you do it to yourself. It's a little bit easier.
Not to keep jumping around, but I wanted to go back to the question about how the treatments work in different settings, because I neglected to mention the radiation clinic that we have at the Boston MGH location, which obviously does not happen, a treatment does not happen while you're getting radiation. So those sessions, both massage and acupuncture, happen right before or right after the radiation treatment. And then you go, the radiation is on lower level 3 primarily, and then you just pop up to lower level 2 to the integrative therapies treatment room, and there's the chair massage that happens in there, and then community style acupuncture where you sit in a chair and needles are put on your arms, legs, ears, and scalp primarily. It's not a full body laid out on table type of treatment, but that style of acupuncture is really, really effective for a lot of the stuff that shows up in radiation therapy. So I wanted to just make sure I mentioned that that's an option as well.
Thank you, Nina.
Mm-hmm.
Can we go to the question about neuropathy? Because maybe you can tell people how they can access last week's, there's one saying any massage suggestions for neuropathy in the feet. Devin, do you want to see if or do you want to refer them to the last week's seminar?
Yes, thank you. Absolutely. So last week, Mike O'Keaney and Irene Martinic presented on neuropathy, and it is now posted on our website. So I can send a link to that recording in the chat. And I will do that now. And I think there was also a question about insurance coverage. If insurance doesn't cover acupuncture, what is about an average cost per session?
Good question. It is part of the services offered at the MGH Cancer Center. So there is no cost for our patients who are seen in the Cancer Center there. In general, acupuncture can vary in its cost. Community style acupuncture, like I mentioned, is usually a little bit more affordable. Again, with COVID, it's tricky because a lot of community clinics can't practice the way that they had been because it's a setting with a group, and obviously groups in an enclosed space are not a thing right now. But those clinics generally are anywhere between $15 to $40 a session, depending on what's all involved. Private acupuncture in the full table experience, again, is anywhere from 50 to 90, depending again on the practitioner and what's all involved in the session and the services they provide. So it can vary, but more and more insurances are starting to cover it. So a phone call might be worthwhile, at least to poke at your insurance company and tell them that it's a service you want.
Questions about mind-body medicine. Do you have to believe in mind-body medicine for it to work?
That gets asked a lot with acupuncture in particular. And thankfully the answer is no. Qi exists whether or not you're fully on board with the concept of it or not. And so mind-body medicine in particular is really safe. There's no side effects. So at the very least, you will relax, which one could argue, is it working right then and there? So a lot of mind-body medicine gets lumped into that sort of not totally hard science medicine, but you don't need to believe in it for it to work. It is an actual thing.
And are there risks associated with mind-body medicine?
I think we touched on some of those. Again, with acupuncture specifically, you are using needles, so all the risks that are associated with a needle. There is a risk of bruising sometimes if you get near a vessel, but that's predominantly the biggest risk involved. It's a very safe and easy procedure to have, and most other mind-body medicines are even less risk averse than that. There's, again, some lab work you want to pay attention to, but otherwise, there's very little risk involved in a lot of this.
If you have a question, please feel free to type into the question box. Kind of looking through here. Karen, can you overdo it when using the pinky ball? Is there too much?
Yes, you can. There's not, I mean, yes, I suppose in an extreme case you could way overdo it, but you're likely to be a little sore the next day. Actually, you know, if the muscle releases, people will often say, okay, this is, I mean, it just feels so much better. There's no pain, but I'm a little bit sore. You may be sore the next day. If you're sore 2 days, then you overdid it. And it's like everything else, like take it a little step at a time and make sure that you're not, that you've looked at the cautions and make sure that you're not pushing too hard. As you've figured out the difference, and I may should have said this at the beginning, the difference with this, what I just described is that a lot of people use pinky balls and roll on them. And actually some people use like foam rollers too, to roll on them. This is a really different technique. And the purpose of this technique is to allow your body time to release the muscle, to you know, rob it of oxygen and nutrients for long enough that it gets confused and releases. Who knows if that's the way it really works, but anyway, it does need a couple of minutes to react. So if you're using, for example, a foam roller, you really want to give it the 2 minutes to work, and just stay static. Just stay with the pressure. Don't roll.
How do I talk with my doctor about using mind-body medicine if they are skeptical?
Karen, you want to take that one?
Oh.
I'm thinking about it.
Say I don't tell them. So, you know what? I think be your own advocate. You know, if it works for you, and it's not getting in the way of your treatment, I think the more we speak of it, the better it gets. That's how we've gotten to where we are today. That acupuncture is covered by a lot of insurances, and there's just millions of people using massage and acupuncture. So if it works, I think speak about it. You know, I think it's important to say this has really helped me.
And I do think that the skepticism is waning.
Yeah.
Sort of like I mentioned in my talk about the word alternative medicine is falling out of favor. And I think when most doctors realize that you're not advocating for an alternative to any of their treatments, they get much more on board and say, oh yeah, you can add, you know, these mind-body medicines for sure if you find benefit from it.
Yeah, I want to second that. Like even 5 years ago, when I spoke to some Harvard medical students, they had zero in their curriculum about anything, mind, body, anything. I mean, that's what I was told. And fast forward to today, a lot of the residents that we're seeing come through, they're huge advocates of our services. So as Lena said, it's going away really quickly. It's almost, we've seen an exponential rise in use of our services, and in people not being afraid to say, you know, this is really helping me and I need it to get through this. And there's lots of good reasons why, and more research that points to that.
We we have just another minute or so if there are any more questions coming in. Well, thank you everyone for joining us this evening, and thank you so much to Karen and Lena. I don't know if you have any final words, or if not, I can just end the session tonight.
Thanks for joining us.
Thanks for joining us. This has been really fun. Thanks. Thank you. And thanks, Devin, for putting all this together. We appreciate it.
Absolutely. Thank you, everyone. We hope you can join us for the next couple of sessions. Take care. Have a great night.